ICD-10-CM code series E00 through E89, they review the following topics: disorders of the thyroid gland, diabetes mellitus, other disorders of glucose regulation and pancreatic internal secretion, disorders of endocrine glands, intraoperative complications of the endocrine system, malnutrition, other nutritional deficiencies, overweight, obesity, and other hyperalimentation, metabolic diseases, and post-procedural endocrine complications and disorders not elsewhere classified. So it's more than diabetes, but diabetes is where you have the guidelines that sometimes are not as straightforward. This is where you have the majority of your guidelines. So let's get into it and let's talk about those guidelines. I'm sure you all know this, but I'm going to repeat it. There are two types of diabetes. You have type 1 and type 2, right? Type 1 is referred to as insulin dependent diabetes. Type 2, non-insulin dependent. Type 1 is also referred to as juvenile diabetes. Type 1 usually occurs early in life, typically in childhood or before the patient reaches the age of 30. Type 1 diabetes patients require insulin to survive. That's why it's called insulin dependent. Type 1 diabetes. When you're coding for type 1 diabetes patient, it is already understood that the patient has or is taking insulin. So you do not code long-term insulin use because it's already understood that a type 1 patient is taking it. So you don't code it twice. In fact, the code is insulin dependent diabetes. The type 1 code is insulin dependent. So it is inherent in the code. So we're not going to overcode. All right. Also, just remember, adults can have juvenile diabetes. Again, although it's diagnosed early in life, they have it throughout the life of the patient. Now, some key things about type 2 diabetes. Type 2 diabetic patients still produce insulin, but because of obesity, age, or weakness, the insulin produced is not enough to keep their blood sugar levels within normal limits. And these type 2 patients, well, this type 2 diabetes is the default if the diabetes is not specified. So if a doctor says a patient has diabetes and you have no way of querying that doctor and you have to make a decision, like when you're taking your exam, if the doctor says the patient has diabetes, they are saying they have type 2. I'm going to say it again. When the doctor doesn't specify the type 2 is the default. Now, something else you need to know about diabetic codes. These are combination codes. Yes, diabetes codes are generally combination codes. Yes, we do have the non-specific codes, but generally they are combination codes, which indicate the type of diabetes. It indicates the body system affected. It also indicates the complication affecting that body system. So the type of diabetes will be indicated in that code, whether it's type 1 or 2. The body system affected will be indicated in that code, whether it's the system nerves, retina, kidney, and the complication will also be addressed in that combination code, and it will be referred to as diabetic neuropathy, diabetic retinopathy, or diabetic neur- nephropathy. Woo, I always confuse neuropathy and nephropathy. Neuropathy speak to nerves. Nephropathy speaks to the kidney. Now remember, coders, code as many codes that are suitable to your doc for your documentation and sequence as your first listed the reason for the encounter, the chief reason for the encounter. Okay, coders, we're going to review some guidelines. And yes, if you can, follow along in your MCG manual. Chapter 4, let's do it. All right, so I didn't ask you, how are you? Are we good, coders? You all doing good? Ready to review these guidelines? Good. Yeah, outstanding. All right, guideline C4A1. This guideline speaks to the type of diabetes. Now, let me tell you, this is a summary of the diabetes. This is guidelines. This is not the complete guidelines, but a summary. And here are some key things we're pulling out and some key things you need to know. Guideline C4A1, type of diabetes, says that age is not the determining factor of the type of diabetes. Like I said before, an adult can have juvenile diabetes. A child can have type 2. So just remember, diabetes type 1 code is E10, and this is insulin dependent diabetes mellitus. And do not assign insulin with this code because insulin use is understood. Type 2, the code is E11, non-insulin dependent diabetes mellitus, right? So the type 2 does not necessarily, diabetic patients do not necessarily use insulin. That's why it's called non-insulin dependent diabetes mellitus. And the documentation has to specify that the patient is using insulin in order for you to code it as long-term use. And remember, coders, if the type of diabetes is not documented, the default will be type 2. Next guideline. Oh, and this is guideline C4A1, C4A2. Next guideline C4A3. Diabetes and the use of insulin and oral hypoglycemics. All right, so here's the guideline. Type of diabetes not documented and the patient uses insulin. So let's say you have documentation and the doctor did not say, doctor said the patient is diabetic, but didn't specify the type, then you go ahead and code it as type 2, and you will use Z79.4, long-term use of insulin. Remember, the default is type 2. And also want to just tell you, if patient is treated with both oral medications and insulin, so both oral medications, oral hypoglycemics, and insulin, you will code the insulin and the oral hypoglycemics. Code them both. And do not code insulin as long-term use. Don't use this long-term use insulin code if the treatment is temporary. If you see that term temporary, we're not coding insulin as long-term use. Now, guideline C15.G. Let me see, is this right? Well, I guess it is C15.G. It's another one too. But for now, C15.G. This is chapter 15, right? So when a patient is pregnant and they have diabetes, let's say their diabetes existed prior to the pregnancy. If it existed prior to the pregnancy, then it's considered pre-existing diabetes mellitus. You're going to code first your O2 4.1 code, code second your code from the E category, endocrine category, your diabetes code, and then third, you're going to code Z79.4 if applicable, if the patient is using insulin or any other treatment. So not necessarily just Z79.4, but anything, oral hypoglycemics, the non-insulin injectables, you're going to code it all if the patient is using it. Now, this type of diabetes existed prior to the pregnancy, but when the pregnancy causes the diabetes, and that can happen when the gestation causes the diabetes, we consider that, or we call that gestational diabetes, and it's coded a little differently, right? So I want to just make that clear. When the pregnancy causes the diabetes, it's called gestational diabetes, and you're going to sequence it as such. You're going to code first your O2 4.4 category. Now, this subcategory code, or this section, this code, it's a little more granular than the pre-existing diabetes, because as you can see, you only have two codes. In fact, you only need one code. The guidelines only specify that you need to use one code, but we're also going to code the week's gestation. Here's why. The code includes the type of diabetes. It includes where in the pregnancy the diabetes is occurring. Are they pregnant, or is this diabetes in childbirth, or is this diabetes occurring in the puerperium, during the puerperium period? Also, your sixth character in the code specifies how it's being treated. So you don't have to code additionally insulin, um, anything. You don't have to code it. You select the code that is integral, that accounts for that. Now, can code your week's gestation, but it is not required because the code identifies the trimester as well. So it's more granular. The gestational diabetes is more granular than the pre-existing, and you're going to see that. Now, just remember, do not code insulin. That's Z79.4. Don't code anything additional because they are integral to the code. Now, coders, see this little woman here? I was looking at her and I said, well, you know what? Some people confuse gestational diabetes and pre-existing diabetes. And I was looking at this woman. I said, you know what? I think she can help me help you know the difference in the codes on site. Let me know if it works for you. It may not. I could see someone saying, no, Mrs. J, just you see that. All right, I digress. I'm back. All right, so pre-existing diabetes, just know it existed prior to the pregnancy. Gestational diabetes is caused by the pregnancy or the gestation. And when you're looking at the code, right? O24.1 is the category code or the subcategory code for pre-existing diabetes. I want to help you distinguish the pre-existing diabetes code from the gestational diabetes code. Why do you want to do that, Mrs. J? because I think it will give you an advantage when you're taking your exam. So, the gestational diabetes code is 024.4. Now, a lot of people say, hey, I cannot, I'm not going to remember that. Well, I'm going to try and help you. Just know that pre-existing diabetes is point 0.1, gestational is point 0.4. Gestational diabetes has the extra 4 in the fourth character space. See? 4. 4 is significant, right? It's significant to me because that woman I was pointing to, the woman that was pregnant, the woman that has the gestation, you can see the gestation, the baby, she looks like a number 4. Coders. Does she look like a 4 to you? You see the gestation in there? See the baby? Someone said she does. She looks like a 4. And somebody saying, you're wasting my time on this, Mrs. Nope, guess what? You're going to see that 4. And anytime you see that 4, the extra, the double 4, the 2 4s, you know it's gestational on site. It was caused by the gestation or the pregnancy. Okay, I'm back. I'm back. We have a couple of more guidelines and then we're going to just go. I'm going to let you code with me. Okay. All right. So, guideline C4A5A, complications due to insulin pump failure. So, when insulin pump fails, either it can underdose, meaning provide less than efficient amounts of insulin to the patient. And when that happens, you code it as T85.6 category mechanical complication. I think it's the full code now. So I think we're going to review this and there's a full code and you'll just code it accordingly. Code second, T38.386, you're going to use the underdose code for insulin. And then your third code, the one that's sequenced third, you got to put your type of diabetes. And then fourth, any associated complications. So this is how you code when the insulin pump fails and does not provide enough insulin to the patient. We call that underdosing. Now, the opposite of underdosing, of course, overdosing. So if you have a situation where the insulin pump fails and the patient receives too much insulin due to that failure, it's called overdosing. And your first code, you're going to sequence this way. Sequence first, your mechanical complication, T85.6. Your second code will be your overdose code, T38.3X1. Your third code is your type of diabetes. And fourth, any associated complication. So it's very similar, but make sure that you select the correct circumstance. If it's an overdose, select the overdose. If it's under, select the under. All right, now we're getting down to our last guideline. And coders, these are not all of the guidelines, but these are the ones that you should really know. You should be familiar. Guideline C4A6BI, sequencing secondary diabetes mellitus due to pancreatectomy. Somebody said it in the chat. They said, hey, it's that secondary diabetes that I struggle with. Hopefully today we're going to nip that in the bud. All right, pancreatectomy caused by the secondary diabetes. In other words, no, that's wrong. That's wrong. So basically, your secondary diabetes is caused by the pancreatectomy. Let's fix that. Okay. All right. So You're going to code first. So that means if a patient had their pancreas removed, then they're obviously not able to produce insulin. So they now have secondary diabetes. They're going to code first E89.1, your post procedural hypoinsulinemia. Hypo's low, right? Low. Code second E13. Code third, Z90.41. This identifies that the pancreas is absent or has been removed. Code fourth, if applicable, code your insulin. And these are the guidelines that you should be familiar with before you test. Now, let's test your knowledge of the guidelines. You ready? Anybody ready? Anybody want to take a break? A breath, not a real break, but like just kind of say, ooh, that was a lot of guidelines, right? Yeah. All right. All right. So here are your instructions. You'll need to locate the guideline, then determine the answer. Coders. Okay, so we're going to read the scenario, then we got to locate the guideline, then determine the answer. I'm not going to give you those steps like inventory, whatever. I want you to focus on those guidelines. And yeah, you might want to inventory if it speaks to you, but identifying that guideline is really going to help you. All right, here we go. Here's your first question. Oh, look at this. We got the An 11-year-old female patient arrives at the doctor's office with her mom with complaints of lethargy and excessive thirst. The physician diagnosed the patient with diabetes. Okay, coders, your time begins now. I want you to find the guideline, then code it. And I know that some of you need a little more time to look up codes, but I believe if you find the guideline, you'll see the codes. All right, your time begins now. What was that? Like 30 seconds? Okay. Did you find the guideline? What say you? This is tough. Good deal. Good try. Excellent, excellent, excellent try. Good try. Okay, coders, what guideline? Yeah, I see some of you all pulling out the guideline. Outstanding, outstanding. All right, so a lot of you said guideline C4A1. Good deal. Also, another guideline is applicable, C4A2. Did anybody see that? All right. So here, first, I'm going to highlight some key terms. When you're coding for diabetes, the age is important. It is. I don't know why, but it is. It's just good that you know. This is an 11-year-old patient, and the patient has diabetes. And the guideline C4A1 is applicable, the type of diabetes. And it says age will not determine the type of diabetes. So, absolutely, the doctor has to specify the type, right? And then guideline C4A2 says if the type of diabetes is not documented, then the default is E11.9. You all with me? And a lot of you said that. Yeah, the doctor did not specify the type. So the default is E11.9. You all with me? Good deal. Somebody said, I'm with you. All right. And guess what? I'm with you too. All right. So if you understand that, outstanding. Good deal. All right, we got another scenario. We got a lot of scenarios, so let's get it going. All right, a 60-year-old female patient arrives to the doctor's office for a routine office visit. She has diabetes mellitus and is on insulin. All right, coders, go find the guideline. Let me know what you've selected. All right, what guideline did you reference? Okay. Good deal. I see you all just coding it out. You all said, forget that guideline. I want to tell you the code. I know that's right. Okay, so um, good job. Somebody nailed it. They said guideline C4A3 outstanding. I'm going to tell you why in a minute. This patient has diabetes mellitus and is on insulin, right? This patient's 60 years old, not real relevant, but we already know age is not the determining factor, but this guideline C4A3 says that diabetes mellitus and the use of insulin, when the documentation does not indicate the diabetes type and the patient is using insulin, then you code it as type 2, right? That's what it says. So E11, that's for type 2. And you're also going to code your insulin if documented. So we're going to code it to E11.9. That's diabetes mellitus, not otherwise specified. And Z79.1, that's long-term use of insulin. All right, coders. Okay, so you all rocked that one. You all see that the difference in the guidelines? Yeah. Okay. All right, we got another scenario. You ready?
Thanks for tuning in, and until next time, happy coding!